Are dental implants painful? Implants are usually regarded as the most efficient solution for replacing teeth that are missing. They do more than just make your smile look better, they aid in improving the overall health of your teeth and health. But a common concern asked by many when thinking about dental implants is whether or not the procedure can be painful. In this clip, we'll look at the issue of pain to dental implants. In addition, we will provide the complete outline of the procedure. The procedure. What are dental implants? Implants made of titanium are posts which are surgically implanted inside the jawbone and act as artificial teeth roots. Implants provide a secure basis for replacing teeth, including bridges, crowns, and dentures. Dental implants are an increasingly preferred option for replacement teeth as they are designed to look and perform just like natural teeth. Additionally, they may help to stop tooth loss within the jaw. Do dental implants hurt to receive? The idea of going through the procedure of removing your teeth can be daunting. However, the reality is that dental implant surgery tends to not be as painful like many believe. Many patients have reported that the process itself is fairly painless due to the local anesthesia given to help numb the site. Certain patients might also decide to use sedation for help their body relax throughout the procedure. The dentist will make an incision through the gum tissue in order to open the jawbone. Then, they will drill an insignificant hole through the bone and then insert an implant inside the socket. Though this sounds as invasive, many patients experience no discomfort during this phase of the procedure. Most discomforts can be controlled with a non-prescription pain relief medication. When the implant is installed in the jawbone, it needs time to heal and become integrated to the implant using the process of the osseointegration. It could take several months. In the meantime, the implant may require a temporary replacement applied over the implant in order to safeguard it and restore function. The patient may experience discomfort while healing. However, it is typically easy to manage and may be relieved through painkillers. What should you expect throughout the process of recovery? The procedure usually isn't too difficult. Recovering is uncomfortable for some patients. After surgery, it is possible to experience bleeding, swelling, or tiny bleeding around your implant's location. Your dentist will supply specific guidelines about how to take care of the site of your implant and how to manage any discomfort. The treatment could involve taking prescription pain medications, using the use of ice packs to decrease swelling, and staying away from certain foods that may be irritating to the surgical site. It's crucial to follow the instructions after surgery in order to have a quick healing. A majority of patients discover that any discomfort or pain they suffer post-surgery is manageable and disappears in some days. But if you experience intense pain, excessive bleeding, or have any other strange indications, please call your dentist as soon as possible. Rarely, patients could suffer complications including the development of nerve injury or infection after the procedure of removing a dental implant. This can result in more painful and uncomfortable symptoms and require therapy. With proper treatment as well as regular dental checks, risks of complications is very low. Are there alternatives for dental implants? If you're not sure to get dental implants because you are concerned concerning pain or other issues, there are other dental implant alternatives available. Dentures and bridges are the two popular alternatives to dental implants, which might be a better fit for certain patients. Bridges for dental use cover the gaps that is caused by teeth missing. They are then anchored through crowns which are linked to nearby teeth. Bridges can be a more minimally invasive option compared to implants. They might be an excellent option in patients who aren't patients for implant surgery. The prosthetic device is removable to replace missing teeth. They can be found in partial and full-length sets. Dentures can be a second option to implants for teeth and be a cost-effective option for dental replacement. The best possible dental replacement solution for you depends on your specific desires and needs. It's important to talk with your dentist regarding the different treatment options and to determine the ideal option for you to restore your dental health and appearance. Implants for dental purposes are a favorite option for replacing missing teeth. Although this procedure might sound daunting, however, the procedure is much less invasive than many people are afraid. The majority of patients experienced little discomfort during the surgical procedure or recovery phase. However, any discomfort could be treated with a prescription. If you're thinking about dental implants, be sure to speak with your dentist. Then, you can consider all your treatment options in order to choose the ideal solution for the health of your mouth. Be aware that having a healthy, beautiful teeth are worth the investment to your overall health.